As a clinician, I spend most of my time dealing with people who are suffering from acute medical problems or people who have long-term conditions who need my input. However, in reality, that's probably only about 10% of the population. The rest of the population we don't know very much about and often have conditions which are developing over time. So population health management enables us to engage with our communities, the people living in our communities, so that we can prevent deterioration of health in the long term and hopefully reduce the risks of chronic disease. We looked at people with obesity, with mental health problems who were smokers. We analysed and linked data which demonstrated a potential impact with a younger patient group in terms of preventing serious chronic disease and health inequalities.
PHM has been important for our profession because it allows us to look at the data, to see what the important issues are for particular cohorts, and to start to tackle those issues on a wider community basis. So it's not just about responding to that patient who walks through the door, it's thinking more about the wider determinants of health and how we can work with our partners in the community to develop good responses that engage with those people and help them with their health and well-being.
My role is in the local public health team, and we have worked with primary care from the start of our local population health management work. Our role in public health is really to support and influence the system to reduce health inequalities. We've got a real opportunity with our population health management work to do that from the start and then ensure that that addresses throughout all of the work we do. We have been working with multiple different partners on this project, which has been really exciting and rewarding. And bringing together lots of linked data from those partners has allowed us to really reduce that silo working. So we're not just looking at each of our priority areas, but as a system and a partnership, actually looking at the wider picture, which inevitably will then support individual and communities so that they're not getting siloed support.
Partners in Somerset are using a population health management approach to improve people's health. They held a health and wellbeing fair to build relationships with key communities.
Well, today we wanted to just invite the general public in, really just to get over the message that there are lots of things that we can do together. And it's not just based on healthcare. We have advice about healthy cooking, about people who are worried about energy use. There's a whole range of different things that we've put together today so that it's going to inform the general public to take charge of their own health.
When I entered the hall, there was a buzz, lots of activities, lots of people laughing, a lot of representatives, people giving lots of information, both mental health, well-being, and there's some very nice soup and food to taste as well.
People can access things they may not know about for their health and well-being. You might be isolated and you need help with your mental well-being. Anybody who wants to quit smoking, of course, and they've done a health walk this morning, which is good for your mental well-being and your physical well-being.
Working together, different organisations can be more effective rather than lots of different things happening in isolation.
Some people avoid certain things and can be in denial about certain health issues. So I think here they feel freer and able to talk about it to somebody who's got just a friendly face.
So today we've had around 40 different organisations coming together, around 150 people come through the door, and it's created a real energy where people have been networking to put patients and the community at the centre of everything we do.